Uterine cancer is a cancer of the uterus. I think that people often get it confused with something called endometrial cancer, and it's really the same thing. The lining of the uterus is called the endometrium, and the muscle is called the myometrium. So uterine cancer is very often synonymous with endometrial cancer, which is cancer of the lining of the uterus. So the wonderful thing about MD Anderson is that patients and the doctors really have the ability to customize care. Someone like Catherine Hale definitely benefited from coming to MD Anderson because she didn't have the usual uterine cancer. And it took us planning a specific treatment for her, which included the chemo and the radiation, which really helped cure her disease.
The great thing about MD Anderson is that we have a great network where we will discuss every case between a radiation oncologist and the surgeon or the gynecologist-oncologist. Sometimes we even have the medical oncologist involved as well. So as in Ms. Hale's case, we actually presented in a large group where there were several gynecologists-oncologists, the pathologists, the radiologists, as well as several radiation oncologists, and we discussed her case and we decided what was the best treatment for her.
My philosophy about treating patients is to treat them with respect, with kindness, and with dignity, and basically to treat them the way I would like to be treated. As a provider of cancer care for women, it's very much a privilege to have this opportunity to develop a long-term relationship with my patients. And that's one of the reasons that I chose this job. And it's also very much a privilege to be at such an institution where we know that we're on the cutting edge of cancer care.
I believe that each patient is individual, and that's the nice thing about MD Anderson. We really look at the person and we look and see where they are, what they're up to, and what support they have, and then we decide what is the best treatment for them.
When you walk in the door, very often your life is changed because you now have the diagnosis of cancer. But everyone that's here is available to help you with your needs. We see our patients so frequently that very often it's not just me that knows the patient. The entire care team knows that patient. And there is a new thing here at MD Anderson called My MD Anderson, where patients can correspond online. So very often the time that a patient spends trying to get an answer from me is minimized because she'll email my nurse will get a hold of me, and we'll get that information back to the patient. But I think it's comforting to the patient because they know the group of us will take care of her. I would say the number one thing for women is to pay attention to their bodies. Women are traditionally caretakers, but they tend to put their own care and their own needs below the needs of others. So they take care of people at work, they take care of their husband, they take care of their children. And if you notice something abnormal, just go get it checked out. Most times it won't be cancer, but in the event that it is, potentially you could live significantly longer or be cured because your cancer was caught early. So listen to your body and be proactive for your health.